Hi, Mr. J. This is our wrist, hand, and thumb eval. I'm Morgan.
And I'm Jenna.
And this whole eval will be done bilaterally, and you always have to make sure to ask the patient permission to touch them first. So first, for patient history, we're going to use Jenna as an example. So do you have any pain, or where does it hurt?
So it hurts in my wrist right about here whenever I try to do a push-up.
And do you have any previous injury to that area?
Yes, I actually broke my radius right here back in April. The first thing we're going to do is bony palpation. So I'm going to start with the styloid process of her radius. So I'm going to follow distally down her radius, which is on the thumb side, till I get to the end, and I can feel a joint space right in here. So that would be the styloid process. And then the next thing I'm going to do is I'm going to palpate her Lister's tubercle, which is where the extensor pollicis longus hooks around. So I'm going to do the same thing, follow distally down her radius till I feel a bump right towards the end, which is right here. And that would be, again, where the extensor pollicis longus hooks around.
Okay, now we're going to palpate the carpal bones. So first we're going to start with the proximal carpal bones. So first we're going to start with the lunate. And so that it's more apparent to me, I'm going to bring my patient's wrist into flexion like so. And I'm going to follow up from their middle finger. And then I'll see a little protuberance like that right there. So right there's the patient's lunate, and then I'll palpate that. So next, with another proximal carpal bone, we're going to palpate the pisiform. This is the bone that we use for our tuning forks, and it's this little protuberant bone right there. Okay, so next we're going to go on to the distal carpal bones. So first we're going to palpate the trapezoid, which can be found at the end of the second metacarpal. So I'm going to follow this metacarpal down. And then I'm going to feel a rise and then a depression. And the depression right here is where the trapezoid will be. And then finally, for another distal carpal bone is the hamate. So I'm going to follow down the fourth and fifth metacarpals. Like that. And then it will be here at the end once I feel the rise and the depression. So again, like right there.
Okay, so the next thing we're going to do is we're going to palpate her metacarpals. So starting with the first finger right here, you can feel the joint space starting right here and then following all the way up to her knuckle. And then the second finger, you can follow the knuckle all the way down to the joint space, which is right here. Third finger, there, fourth finger to there, and then fifth finger right here. And then next we're going to palpate her phalanges. So with the thumb, we only have a proximal phalanx and a distal phalanx. Then we have the proximal bone right here, the middle phalanx right here, and then the distal phalanx is the last part right there. And then that would be on every single finger. So the third finger, there's the proximal, the middle, the distal, same thing, proximal, middle, distal, and then the fifth finger, proximal, middle, and then distal. And then lastly, we're going to palpate her PIP joints. So we just have on the PIP joints are just located on the fingers 2 through 5. So they're in between the proximal bone and the middle phalanx right here. So it's this knuckle right here on the third, fourth, and then the fifth.
Okay, so now we're going to move on to fracture testing. So first I'm going to percuss the fingertips of my patient. So I'm just going to have her fingers out like so. I'm going to give each one a nice little tap. Again, just like this. Then a positive would be like pain radiating throughout their fingers. And then the next one is passive wrist extension. This can also be used as a scaphoid fracture test. So I'm going to grab onto my patient's hand like this, and I'm going to stabilize at the wrist, and I'm going to passively put their wrist into extension with radial deviation. So again, passively extend their wrist with radial deviation. And then a positive would be pain in the scaphoid bone, which is right here, and or in the snuff box, which is also right here. And again, this can also be used as a scaphoid fracture test. Okay, so now we're going to do range of motion testing. So first we're going to test wrist flexion, and I'm going to have my patient's arm like so, like this. And I'm going to take my axis of the goniometer and line it up with the wrist joint. So I'm just going to find that space. and then place it right there. And I'm gonna have my non-movable level arm here on the ulna. And then I'm gonna have my movable lever arm here in line with her pinky. And so I'm gonna ask my patient to actively push her hand down. So go ahead, actively push your hand down. And that went about 85. So now I'm going to passively push her hand back. And that went about another 12. I perform range of motion testing for supination. So I'm gonna have my patient seated like this with her arm out at 90 degrees. And then I'm going to place my axis of the goniometer at her fingertips like so, with my stabilizing level arm parallel to the floor. Then I'm going to bring the movable level arm right here. And then I'm going to have them externally rotate. So go ahead. I'm going to follow along with her. And that went about 90. And then I'm going to take my hand and passively push her down a little bit more. And that went about 12.
All right, so the last range of motion test that we're going to do is for ulnar deviation. So I'm going to start by finding her joint space, which is right here. I'm going to place my axis right on that, and then put her stabilizing lever arm splitting her forearm like so, and then the movable lever arm is going to go down her third finger like that. All right, and then I have her go into ulnar deviation, which is going to be towards her right. Go ahead. All right, and that went about 32 degrees, and I'm going to passively push her a little bit further, just like that, and then she went about another 8 degrees.
Now we're going to move on to the palpation of ligaments. So first we're going to start with the radial-collateral ligament. To find this, I'm going to grasp the thumb like so, and then I'm going to feel right here on the radial side of the thumb. It's going to be right about here, right in that part right there. Okay, so next we're going to do volar plates, and volar plates can be found in the hand and the fingers. So in the hand, they're going to be about where the knuckle is. So right there, right there, and also here on the thumb. And then they can also be found in the fingers where there's an IP joint. So it'd be right here, there, at the proximal and the DIP of each finger. And then it would also be here on the thumb. Okay, so now we're going to do some more ligamentous testing. We're going to do radial and ulnar ligamentous stress testing. So first for radial, I'm going to place my hand proximally from the joint space right there. And then I'm going to grab my patient's hand like this and put them into radial deviation like so. So then for the ulnar aspect of this, we're going to put the patient into ulnar deviation like so. So again, this is testing the ulnar collateral ligament, and then this was testing the radial collateral ligament.
The next thing we're going to do is some muscle palpation. So I'm going to start with the extensor carpi radialis longus, and this muscle originates on the supracondylar ridge of the humerus, so right in here, and that's going to insert onto the dorsal base of the second metacarpal, so right there. So it's going to go from the supracondylar ridge down to the dorsal base of the second metacarpal. And then that's the action of this muscle is extension and abduction, and then it's innervated by the radial nerve. And then next we're going to do the extensor carpi radialis brevis, and this is going to originate on the lateral epicondyle, so right here. And then it's going to go down and insert onto the dorsal base of the third metacarpal, so right in here. So again, from the lateral epicondyle down to the base of the third. And that action is also extension and abduction, and it's also innervated by the radial nerve. And then finally, we're going to do the extensor carpi ulnaris, and it originates again on the lateral epicondyle, and then inserts onto the medial base, the tubercle on the medial base of the fifth metacarpal, so right here. So again, from the lateral epicondyle down to the tubercle and the pinky right here. And that action is going to be for extension and adduction. And then this is innervated by the posterior interosseous nerve.
Okay, so next we're going to palpate the belly of the extensor muscles. So I'm going to put my hand right about here. And then for me to feel this easier, I'm going to have my patient start putting their wrist into extension. So go ahead. And then again, if I place my hand right here, you can even see it. Those muscles are firing. So again, that's right about here is the belly of the extensors. Okay, so next we're going to palpate the thenar eminence, which is this meaty part right here on the thumb. And this is composed of 3 muscles. So from laterally to medially, it's the abductor pollicis brevis, the flexor pollicis brevis, and then the opponens pollicis. And again, those 3 muscles make up the thenar eminence, which is right here on the hand.
Next muscle we're going to do is the extensor indicus, and this muscle originates at the posterior surface of the ulna, so this bone right here, and then with the adjacent interosseous membrane, so right there. So it goes down and inserts onto the extensor hood of the index finger, so right here. So again, from here down to the extensor hood of the index finger right there. And that goes together with the extensor digitorum. And its action is extension of the index finger, just like that. And also the extension of the wrist. And then the nerve that innervates this muscle is the posterior interosseous nerve. So again, from here down to there. And then the next muscle we're going to do is the extensor pollicis longus, which also is known as the ulnar border of the anatomical snuff box, so right there. So it originates again the posterior surface of the ulna, over here, and then with the adjacent interosseous membrane, so from there down, and then it goes into and inserts onto the dorsal surface of the base of the distal phalanx of the thumb, so this one right here. So again, from here to the distal end of the distal phalanx of the thumb right there. And the action of this is extension of the thumb at all joints. So go ahead, extend your thumb like that. And you can see it right there sticking out. It's very prominent. And it also is innervated by the posterior interosseous.
Palpate is the flexor digitorum superficialis. So this muscle flexes the PIP, the MCP joints 2 through 5, and the wrist. So its origin is the medial epicondyle, which is right about here. Its origin is the medial epicondyle, and or also known as the humeral ulnar head and radial head. And so it inserts onto the base of phalanges 2 through 5. So that's the base of phalanges 2 through 5. Base of the middle phalanges 2 through 5, excuse me. So that would go up to here. So again, so its origin is the medial epicondyle, and then its insertion, we follow it up to the base of the middle phalanx of 2 through 5. So that would be here, 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 and here. So again, origin to insertion. And that would be for each of the digits 2 through 5. And that is innervated by the median nerve. And then the next muscle we're going to palpate is the flexor pollicis longus. And this is responsible for flexing the thumb, like that. So its origin is the middle half of the anterior surface of the radius, so that's right about here. And then it inserts onto the distal base of the phalanx of the thumb. So that's here. So again, origin to insertion, right about there. Base, again, base of the distal phalanx of the thumb is its insertion. And then the nerve is the median nerve for this one. And then finally, we're going to do the adductor pollicis muscle. So this is a muscle in the hand, and it is responsible for adduction of the thumb at the carpometacarpal joint. So that's just inward of the thumb, like so. And this actually has 2 origins. So if we're going transversely, then the origin is the anterior shaft of the 3rd metacarpal. So that would be like right about there. And then if we're going obliquely, then the insertion is the adjacent bones of the 3rd and 4th metacarpal and the capitate. So the 3rd and 4th metacarpal, right out here, and the capitate, which comes into there. So again, those are the origin. Then the insertion is the medial side of the base of the proximal phalanx of the thumb and its associated extensor hood. So again, we're going to go from our insertions, which are over here, and all the way over here to the medial base of the proximal phalanx. So again, from insertion to origin. And again, this is responsible for adduction of the thumb, and it is innervated by the deep branch of the ulnar nerve.
the next thing we're gonna do is some ligamentous testing. So I'm gonna start with the carpal metacarpal joints. And what I'm gonna do here is I'm going to grab the proximal end of the metacarpal that I'm testing, and then also its corresponding distal row of carpal bones. So the first one's going to be the first metacarpal, which is the thumb. So I'm gonna follow it down to where it dips, right there. So that's going to be the trapezium, right about there. And I'm gonna do a shearing action like this. And I'm looking for an endpoint, the second metacarpal right here, follow it down, right there. And that's going to be the trapezoid. Do the shearing action like that. Good. The capitate, which is the third metacarpal. So following that down right into there, just like so. And then the fourth and the fifth metacarpals are going to correspond to the hamate. So following down here, finding that joint space right there. All right, and I'm gonna do the fourth metacarpal first, that, and then the fifth metacarpal like that.
So to continue with ligamentous testing, now we're going to ligamenously test the volar plates. So I'm going to stabilize my finger back against the knuckle so that when I pull the patient's finger back like that, I'm looking for an endpoint, and this kind of helps me do so. So I'm going to do it at the MCP joints and all IP joints. So again, at the MCP joint, like that, and then at the IP joints. And I'm looking for endpoints. And if there wasn't an endpoint, then my patient would be able to bring their finger like all the way back. And then just one last one. Like that.
Okay, so the next set of testing that we're gonna do is some muscle testing. So I'm gonna start with the extensor muscles. So what I'm gonna have to do is have the patient have her arm fully extended on the table like so, because the origin of the extensor muscles passes through the elbow. So we're isolating just this muscle, the extensor muscles. So I'm gonna stabilize her arm just below her wrist right here, and have her wrist hanging off the table a little bit. And I'm gonna have her go into pre-stretch like so. And then I'm gonna have her actively raise her hand to the ceiling. So go ahead. Good. Then I'm gonna do some active resistance, same thing. Go ahead. Good. And then about halfway. All right, we're gonna go into a break test. Ready, resist my push, go. 1, 2, 3, 4, 5. Good. All right, and the next test we're gonna do is for the flexor digitorum superficialis muscle. So for this one, I'm going to stabilize her finger, right, just proximal to her PIP joint like so. I'm gonna put her in pre-stretch like this. I'm gonna have her also raise her finger to the ceiling. Go ahead. Good. All right, now adding a little bit of resistance. Same thing. Go ahead. Good. All right, and then about halfway, I'm gonna have her resist my push. Go ahead. 1, 2, 3, 4, 5. Good. And I'm going to repeat this process on each of the digits 2 through 4.
Now we're gonna muscle test the extensor digiti minimi, which is primarily for the pinky and or the fifth finger. So I'm going to stabilize at the proximal MCP joint of the fifth finger, so right here. And I'm going to have my patient actively bring their pinky up like so, but first I'm going to put them in pre-stretch. So go ahead, bring your pinky up. Good. And then I'm going to have them do the same thing, but I'm going to apply a little bit of resistance. Go ahead. Good. And then we're going to do a break test. I'm going to bring them halfway. I'm going to tell them, don't let me push your pinky down. Ready? Go ahead. 1, 2, 3, 4, 5. So then I'm going to flip my patient over, and I'm going to muscle test the lumbricals. So for the lumbricals, I'm going to stabilize at the MCP joints. So I'm just going to bring my thumb across like so. And I'm going to tell them to bring their hands up like this actively, but first I'm going to put them in pre-stretch. Okay, so go ahead, bring your fingers up. Good. And then we're going to do the same thing with a little bit of resistance. Go ahead. Good. Then we're going to do a break test. So I'm going to bring her fingers halfway. I'm going to tell her, don't let me push you down. Ready? Go. 1, 2, 3, 4, 5.
Okay, so the next muscle I'm going to test is going to be the interossei palmaris. And what this does is adduction of fingers 2, 4, and 5. So I'm going to stabilize at her metacarpal like so, like this, and I'm going to have her try to bring her pinky up towards her middle fingers. Go ahead, put her pre-stretch, actively go ahead, good, and then add a little bit of resistance, same thing, go ahead, good, and then I'm gonna do a break test about halfway, ready, go ahead, 1, 2, 3, 4, 5, good, all right, same thing with this finger, put you in pre-stretch, actively go ahead up to your middle finger, good, some resistance, go ahead, up to your middle finger, good, and then halfway, resist my push, go ahead, 1, 2, 3, 4, 5, good, and I'm going to flip her hand like so, just to get her second finger, same thing, stabilizing just below her metacarpal joint right there, all right, and then go ahead, bring active resistance like that, or I'm gonna put her in pre-stretch like this, and then go ahead, bring your finger up to your middle finger, good, some active resistance, go ahead, good, and then halfway there, I'm gonna have her resist my push down, ready, go ahead, 1, 2, 3, 4, 5, good. All right, and then the next test we're gonna do is for the extensor pollicis longus and brevis. So first for the longus, I'm going to stabilize just below her wrist joint like that, and I'm gonna have her put her thumb up towards the ceiling, like so. Okay, ready? I'm gonna put her in pre-stretch like this. Go ahead, bring your thumb up to the ceiling, good. All right, and then for this test, for the longus, I'm going to put my resistance on the distal end of her distal phalanx like this. So again, pre-stretch, add a little bit of resistance, go ahead. Good, all right, and then about halfway, I'm gonna have you resist my push. Go ahead, 1, 2, 3, 4, 5, good. All right, and then for the brevis, we're going to add the resistance just above her MCP joint. So just distal to her MCP joint. So I'm gonna do the same thing, put her in pre-stretch, bring your thumb up to the ceiling, good. All right, and then add my active resistance, go ahead, good. All right, and then my break test, about halfway, go ahead, resist my push, 2, 3, 4, 5, good.
Muscle test the adductor pollicis muscle. So I'm gonna stabilize my patient like so. And this muscle is responsible for the adduction of the thumb. So I'm gonna put her in a little bit of pre-stretch and then have her bring her thumb into her hands. Go ahead. Good. I'm gonna do the same thing with a little bit of resistance. Go ahead. Good. And then for break, I'm gonna bring her about there, halfway. Then I'm gonna say, don't let me pull your hand back. So resist my pull. Ready? Go. 1, 2, 3, 4, 5. Okay, and then while we're here, we're gonna do the opponent's digiti minimi muscle testing. So this muscle is responsible for opposition of the hand, like so. So I'm gonna wanna stabilize along the 5th metacarpal joint here, and then also along her thumb like so. But first I'm gonna put her in pre-stretch on both fingers like so, and then I'm gonna have her actively bring her fingers together like that, good. Then we're gonna do the same thing, just with a little bit of resistance, so go ahead. Good. And then for break, I'm gonna tell her to resist my push. Ready, go. 1, 2, 3, 4, 5.
So the next thing we're gonna do is some special testing. So the first special test is going to be the Allen's test, and what I'm looking for here is her circulation to her hand and her fingers. So what I'm gonna do is I'm gonna put some hard pressure on her median and radial arteries, like so. And I'm gonna have her squeeze her hand 10 times. Okay, and see how her hand is pale white. I'm going to release one at a time. And what I'm looking for is a flush of blood flow back into her hands, like so. And you can see it separately, so from the 1st, 2nd, and 3rd, and then lastly, the 4th and 5th fingers. So that would be a positive test, is the blood flushing back into her.
The next special test we're gonna perform is the Tinel sign. And this is testing the median nerve involvement. So I'm going to find the patient's palmaris longus and then go laterally to it. So I'm gonna be right about here. And I'm just gonna give a couple firm taps. So, and I'll ask them, do you feel any tingling?
Yes.
And that is a positive sign, is tingling. And again, that's for median nerve involvement.